Doctor, what is fever of unknown origin?
Fever of unknown origin, or FUO, is diagnosed if you have fever, a high temperature of more than 101 Fahrenheit, for at least 3 weeks for which the cause cannot be determined after diagnostic tests have been done. It is also known as PUO, pyrexia of unknown origin.
Doctor, what causes FUO?
The 3 major groups of causes are infections, tumors, and collagen vascular diseases. Infections are the most common cause, and these include many conditions such as endocarditis, which is an infection of the heart's lining or valves, tuberculosis, abscesses, and viral infections such as cytomegalovirus infection. The second most common are tumors, and these include Hodgkin's and non-Hodgkin's lymphomas, leukemia, multiple myeloma, and renal, liver, colon, and breast cancers. The final group are the collagen vascular diseases include systemic lupus, rheumatoid arthritis, and scleroderma. They're caused by the body's immune, infection-fighting system attacking its own organs. The most common collagen vascular disease in young people is juvenile rheumatoid arthritis, while in older people, it's inflammation of the temporal artery, found at the temple region of the head. Other rarer causes of FUO are drugs such as antibiotics, antihistamines, anti-itch drugs, anti-inflammatory drugs, and medicines used for acid reflux and peptic ulcers.
Doctor, what are the symptoms of FUO?
The medical definition describes the symptom: a temperature of 101 degrees Fahrenheit, 38.3 degrees Celsius, for more than 3 weeks and no diagnosis after 1 week of evaluation.
Doctor, how is FUO diagnosed?
As part of the evaluation, your doctor will take a detailed history, do a physical examination, and order blood tests. If the diagnosis remains unclear, the doctor may order imaging studies, such as X-rays and computed tomography, or CT, of the chest, abdomen or belly, and pelvis. Echocardiography, an ultrasound test using sound waves to take pictures of the heart, will be done.
Doctor, how is FUO treated?
The disease causing the fever must be treated. A doctor who specializes in infections will help with diagnosis, evaluation, and treatment of infectious diseases. Antibiotics will be given for infections. If a tumor is found, an oncologist, a doctor specializing in cancer treatment, will be involved. For a collagen vascular disease, a rheumatologist, a doctor specializing in joint and collagen vascular diseases, will help.
What are the do's we should remember?
Do remember that your doctor won't usually start using medicines without making a diagnosis. If the FUO remains undiagnosed, your doctor may just watch for more symptoms. Do report any new symptoms if you are being evaluated for FUO. Symptoms that may help make the diagnosis include cough, sputum production, shortness of breath, abdominal pain, diarrhea, bloody stools, muscle aches, joint swelling, bone pain, or burning with urination.
What are some of the dens when dealing with FUO?
Don't get frustrated. FUO may be very hard to diagnose. We cannot find a diagnosis in about 5% to 15% of cases. Don't self-medicate. Follow the instructions of your doctor and specialists. Don't forget that infection is the main cause of FUO. Common infections include urinary tract infections, pneumonia, tuberculosis, endocarditis, osteomyelitis, infection of the bone, Lyme disease, gonorrhea, syphilis, herpes, HIV, AIDS, and abdominal abscesses. For more information, log on to www.healthlibrary.com.